They made their own soap. However, with the Industrial Revolution, among the many, many industries that rose up was soap manufacturing. And with all the new technologies back in those days, soap was being manufactured left and right in mass quantities. What were they going to do with that soap? Sell it. They had to sell it. So began, as documented in actually quite a few texts, a massive, insidious marketing effort to literally change the American mind. That's in some of the old advertising internal literature from the advertising. I didn't even know there were advertising agencies in the late 1800s, but apparently there were. And they said, we need to change the American mind and make them believe that they are dependent on what we have to sell them. Now you've got to connect some dots, but it's pretty easy to connect, that eventually what that leads to is the status of the expert. I have knowledge, information, and techniques that you need. You can't get them anywhere else, and I'm the best to provide it. That is both our legal system and our healthcare system. It's part of the addictive trend. The next addiction, of course, you know this one, the addiction to ownership, aka monopoly. Now those bullet points right up there, I won't read them, you can analyze them. They did not come from a text on healthcare regulation. They did not come from a critique of the healthcare system or the legal system. They came straight out of a generic textbook on antitrust law. These are the stock and trade symptoms of a monopoly. Do you recognize any of them? And lastly, my favorite, the addiction to power, also known as parens patriae. Now you might have expected to see the words police power up there. But I've got that phrase up there for a reason. Does anyone know, besides Diane, what parens patriae means? It is Latin for, anyone take a guess?
Father parent. Father parent.
Government as parent. Police power, which is the stated authority by which the government regulates health care, is, as you know, expressly designed, intended, and authorized to protect against harm. Parens patriae, which I contend is the authority that's actually being used to regulate health care, is a little bit different. Parens patriae, and it's a stated authority, I didn't make that phrase up. Parens patriae, government as parent, is used to determine what's good. Connect that dot if you would, please. The difference between protecting against harm and determining what's good. There are, to my knowledge and research, only two examples, only two instances when the authority of the state to exercise its parens patriae rights is when there is a minor who is unable to care for her or himself, or a mentally incompetent who's going to be involuntarily committed. When the state exercises its authority of parens patriae over health care, which I believe is the case, what is it saying about the state's relationship to us? We're too immature and or we're incompetent. Make no mistake about it. And this is an addiction. All 7 of these are addictions. That's what we're up against, I believe. And it's formidable. That's a formidable set. Now, here's the toughest part for me. I've already told you. I came from the dark side. My name is Michael. I'm an addict. Truth be told, I got 20 years of that in my system. And I am only beginning to realize I still fight it every day. I share this with you, not just to unburden myself, but also to emphasize this is a formidable burden. I made a strong commitment 4 years ago to make this change. I've worked my rear end off. I don't have one, as you can see, so it's gone. I've been working my rear end off to follow this learning curve. And yet I am still afflicted. Johanna asked me in my filming, how many health freedom lawyers are there in Washington State? Do you need more? Absolutely. Absolutely. But as far as I'm concerned, whether overtly or more likely than not covertly, I need to address those addictions in my colleagues, in their clients, and in the general public. Uniquely suited, perhaps I am, as an addict. What's the cost of the addiction that I just talked about to these structures and functions of the body politic? The costs show up in many different ways, but in particular, they show up in our personal health, in the body, and they show up in the body politic, our healing relationships as well. Science shows that compared to the uniformity of even the highest primate, human beings differ so much from one another that innate individuality in structure and function cannot be denied. To me, this is a clear indication of what my intuition has told me for a long time, that what is healthy for me is not necessarily what is healthy for you. My experience of health is not necessarily the same thing as your experience of health. We heard Clinton read the principles earlier. Health is more than the absence of disease. And in that regard, health is a very, very individualized experience. Moshe Feldenkrais, who was a considerable health freedom practitioner himself, said this: subjective reality is the first, the richest, and the most important to our emotional, mental, and physical well-being. Translated, subjective reality is most important to our health. That is my personal experience of health freedom. Most health freedom practitioners and their clients echo that sentiment. In fact, even science supports that to a degree. Here you see on the right-hand side, this is Feldenkrais again. In his research, 1 cell out of every 10,000 is used by our bodies to bring in information from objective reality. The rest of the organism is used to process subjective reality. Indeed, health is more than the absence of disease. Aaron Antonovsky, American-Israeli scientist and researcher, said pretty much the same thing that Clinton read to us earlier. Health is the process by which we create meaning. Health is the process by which we create and experience meaning, physically, mentally, and spiritually. Consider now what those addictions do. Start to consider what those addictions do to this particular resource for our personal health. Consider also now, not just our personal health, but in the realm of the body politic. What do those addictions do to our healing relationships? As a lawyer, I am very familiar with what we call privileged professional relationships. Lawyer-clients. The law cannot pierce the lawyer-client privilege because it's protected. It has a certain stature of respect in the law that the law will not, except in very unusual circumstances, penetrate. The minister-penitent privilege, and of course, the doctor-patient privilege. I submit that the healing relationship transcends them all. It is the most intimate relationship we can have. It is, in fact, the relationship, whether we know it or not, that we already have with one another.